Every pregnancy is a journey of hope, but for too many women, it becomes a fight for survival. In our last episode, we introduced the biggest threats to maternal health. Today, we continue with 3 silent killers that still take the lives of thousands of mothers every year: sepsis, eclampsia, and obstructed labor. First, let's talk about sepsis. The hidden infection. Sepsis is a severe infection that can spread during or after childbirth, and it's responsible for about 10% of maternal deaths globally. How does it happen? It often begins with prolonged labor, the use of unsterile tools, or when parts of the placenta are left behind after delivery. Once harmful bacteria enter the bloodstream, the infection spreads with frightening speed, leading to organ failure within just a few hours. The warning signs can be subtle at first, but escalate quickly. Look out for a fever, severe abdominal pain, a foul-smelling discharge, and a rapid heartbeat. If any of these appear, it's a medical emergency. Imagine this scenario, which happens all too often. In many rural areas, women give birth at home, sometimes with unsterile tools or without proper hygiene. A few days later, a fever starts, followed by intense pain. By the time they manage to reach a hospital, the infection has already done irreversible damage, and it's too late. The lesson here is crystal clear. A safe, clean delivery environment and early postnatal checkups are not just best practices, they are absolute lifesavers. Next up is eclampsia, a condition where high blood pressure turns deadly. Eclampsia is what happens when a condition called preeclampsia, which is severe high blood pressure during pregnancy, progresses and causes seizures. It can strike suddenly. It's terrifying, and it's one of the leading killers of pregnant women worldwide. The key is to catch it before it becomes eclampsia. So, what are the warning signs of Pay close attention to a severe, persistent headache, blurred vision or seeing spots, noticeable swelling in the hands and face, and, of course, high blood pressure readings during check. Let me share a story that illustrates the danger. A young mother-to-be noticed her feet were swollen, but she dismissed it as a normal part of pregnancy. She felt fine, so she skipped a few of her scheduled antenatal visits. Then, one day, she suddenly collapsed with violent convulsions. Her preeclampsia had turned into eclampsia. This tragedy could have been prevented with regular blood pressure monitoring and simple urine tests. The doctors could have detected the problem early and managed it with medication like magnesium sulfate. The message couldn't be more direct. Antenatal care is not optional, it is life-saving. The third hidden danger we need to discuss is obstructed labor. This happens when the baby simply cannot pass through the birth canal. There are several reasons this can occur. The mother's pelvis might be too small, the baby might be unusually large, or the baby is in the wrong position for delivery. Without skilled medical care, labor can drag on for days. This prolonged struggle leads to complete exhaustion, severe dehydration, and an increased risk of infection. In the worst cases, the uterus can rupture, a catastrophic event that leads to massive bleeding and often death for both mother and baby. Consider this heartbreaking reality. In some remote settings, women labor at home for 2, even 3 days, hoping for a natural delivery. By the time their family realizes something is terribly wrong and they arrive at a hospital, they are exhausted, infected, and often beyond help. Yet, with a timely cesarean section, a procedure that can be completed in under an hour by a skilled team, both mother and baby could have survived and been perfectly healthy. This is why having a skilled birth attendant present during delivery is non-negotiable. These 3 killers, sepsis, eclampsia, and obstructed labor, are a stark reminder that maternal death is not an unavoidable fate. It is a failure of systems, a failure of awareness, and a failure of access to care. Clean delivery practices, consistent antenatal care, and the presence of skilled health workers are the pillars that can prevent these tragedies. In our next episode, we'll turn our attention to the sensitive but critical topic of unsafe abortion and explore the vital role that nurses and entire communities can play in protecting mothers. Thank you for watching. Please like this video, subscribe to our channel, and share your thoughts in the comments below. How can our communities better support expecting mothers? Stay tuned, and remember, Every pregnancy deserves safety, dignity, and hope.